When I ask most parents how breastfeeding works, I usually ask them if they would agree that you put the nipple in the middle of the baby's mouth and the baby will take the nipple and the breast will be full of milk and this will just drain into the baby's mouth. And I would say 95% of the time people will agree that that's how breastfeeding works. And this is a very big problem because if this were to occur, the baby would be nipple feeding. And nipple feeding is excruciatingly painful for mom. So mom will be in excruciating pain and the baby will not be getting very much milk because the baby needs to suckle on the areola, the area around the nipple, in order for the hormones to be released in the brain in order to tell the breast to make and deliver milk. So although this seems to be the way that most people think breastfeeding works, it actually is very concerning because babies do not nipple feed. So how do we get the baby to breastfeed? Babies have a number of reflexes and they will cue when they are hungry. Just like our behavior changes when we are hungry, your baby's behavior will change when they are hungry. When your baby gets hungry, they will put their hands to their mouth, they will lick their lips, and they will often open their mouth wide and turn to the side, just like that. A little bit cuter, but just like that. And that's called the rooting reflex. And you want to make sure that you are using the rooting reflex when you are bringing the baby onto the breast. The reason for that is we want to make sure the baby is taking the areola into their mouth and not just the nipple. It's really upsetting to me when I hear mothers say that breastfeeding is more painful than labor, because breastfeeding should not be painful at all. Nipple feeding, on the other hand, is very painful. So if you are looking at your baby and thinking about this, we definitely have a problem. So if you can't seem to get this out of your mind, here's a suggestion. If I were to put my finger in this alligator's mouth, that certainly will cause a lot of pain. But if I can put as much of my fist into the alligator's mouth, it won't be able to do the same harm. And that's a little bit the same way we can think about breastfeeding. We do not want the baby to be suckling on the nipple. We want to get a nice big mouthful of breast into the baby's mouth. So how do we do that? Bring the baby to the breast and hold the baby in a way that you will have some control. This is a nice way to bring your baby to the breast because you are able to support your baby and at the same time you will have control so that you can protect your nipple. You'll notice that my hand is far back. You can touch the baby's top lip with the nipple, and doing this will cause the baby to have that nice rooting reflex where the baby will open his mouth wide. When the baby does that, how long do you think you have to get your nipple to the back of the mouth where it will be safe? You don't have very long to get your nipple back to safety, and you need to protect your nipple. So again, it's really important to remember that when you're bringing the baby to the breast, you don't want to let the baby have the nipple. Instead, you want to wait for a nice big mouth. And when you see that nice big mouth, you want to bring the baby so that their chin and lower jaw is below the nipple on the areola. So it's an asymmetrical latch. The chin comes in first, and then you bring the baby on chin first, and the rest will follow. This way, the nipple will be at the back of the baby's mouth where it is free from harm, and the baby will be sucking on the areola. And while the baby sucks on the areola, the brain will have these nice hormones released, which will communicate with the breast and tell the breast to make and deliver milk. So mom will be happy and won't be in pain or discomfort, and baby will be getting lots of breast milk.